All right, we are going to talk about some of the basics of giving yourself an injection, whether it's a peptide or NAD or glutathione. These are some of the foundational basics that you need to know. So to begin with, you're going to have a vial and it's probably going to have a cap on it. And that cap could either be like this, and that you would flick off in order to expose the rubber hub and draw it up. Or other vials like NAD will have a metal cap. So this guy's a little bit harder to get off. You could use your nail and flick it up. The other option is to use a butter knife or a pair of scissors, but you can see now I've got that up, and that's going to expose the rubber hub. In order to draw up the medications, you want to always sterilize the rubber hub with an alcohol wipe before you put the needle into it. And so when they've been in your refrigerator, before you get started to drop the medication, always just really clean these thoroughly in order to remove any bacteria. And those are ready to go. The other important point about drawing up medications is that you want to be very careful about not making the needle get dull. So when you draw it up, first of all, let me walk you through this little syringe. There's a cap on it, and then there's a second cap where you have the actual plunger. But back to drawing it up, I like to recommend that you have it on a flat surface and you go straight in. This allows you to do it in one puncture. Next, you invert to draw up the medication and then take the syringe out. So again, you want to make sure you have it on a flat surface. You're going in perfectly straight, one puncture, and then invert. And as you can see, as a solution is coming up in this small syringe, it should be filling the barrel. So you always want to check to make sure that it's filling the barrel. All right, so that's the basics. Now we're going to get into actually using your medication. All right, so now I'm going to walk you through BPC injection. BPC is a very good peptide for inflammation and recovery. It is generally in a vial already as a liquid, so you don't need to reconstitute it, and the cap may have a metal top, so this one I've already taken off. I'm just using this bottle as an example. Typically, you're going to do somewhere between 15 to 25 units. So before I draw it up, I want to clean the hub with alcohol. I'm going to then take off the cap from my needle and from the syringe plunger, and then you can put it flat on the surface and go in straight. The reason we do that is so that we only have one puncture and we don't dull the needle. I'm going to invert it up, and now I'm going to draw up the 25 units as an example. Okay, so I've drawn it up. All right, I have my BPC drawn up. Now BPC is really unique because you can use it as a subcutaneous injection, and that can be for general purposes. So doing it on your abdomen is a typical injection site. It also could be in the back of the arm or on your thigh. But for certain protocols, you're going to try to inject near the injury. And so that might be your shoulder or your knee. So you might want to be using a subcutaneous injection in that area. So for the abdominal injection, you're going to simply clean the area, 45-degree angle, and inject. I'm going to demonstrate on the shoulder for this video. Okay, so I'm having shoulder pain. I'm going to use the alcohol wipe, and I'm going to clean the area. And now it's a little hard to pinch and inject, but I have a lot of soft tissue there. I'm just going to go in at 45 degrees, nice, easy approach. And now that I have the needle underneath the skin, I can depress the plunger and inject the medication. So it's pretty easy. Once I'm done, I take out the needle and I'm going to just alcohol the skin so that way it gets absorbed well. Your protocol with BPC might include TB4, thymosin beta 4. If that's the case, you're going to want to inject those as a combination. So to save a little bit of time, you can draw up the BPC, then get your TB4, draw that up in the same syringe, exactly the same way, and then be able to inject that at one time. The caveat is you might need a larger syringe that has 100 units if you're doing a larger dose. Just make sure that your syringe can hold it. But typically, it's 25 of BPC and 25 of the TB4, so a 50-unit syringe should be able to cover that. Once you've drawn up, same protocol, under the skin in a subcutaneous injection, either localized at the site, or if you feel like it's a larger volume and you wanted to do it on the abdomen, that's fine as well. As an example, if you were drawing up the BPC first, do it on a flat surface, invert, draw up the 25 units. I can see the solution is slowly filling the syringe. Then keeping the same syringe. Of course, I'm alcoholing each time. And now I'm gonna do one puncture and go to 50 units. And now I have the combination. Just keep in mind, minimize the number of punctures, because if you do it multiple times, more than 2, the needle could be very dull, and that would be more uncomfortable when you do the injections. So if you want to do them separately, you can, but there's an option to combine it when it comes to BPC and TB4.